Right? Right? That's the phone. Can you go on in there from there? Okay. And then call me. We'll talk how she. Call my phone. Hello. Unit இல்ல தெரியுதா? Clear தெரியுதாங்க? Can you hear me talking through the speaker there? Okay. Yeah, I have it. Okay, what's the time now? 4:41. 6:41. Okay. I'll play an audio. Okay, anyway, they can hear me too. So yeah, just testing the microphone. I'm going to play some audio. Let me if you can hear it. Okay, I have to make sure that the audio is going out through the speaker. So,
the cricoid cartilage sits immediately on the trachea, and the thyroid cartilage articulates with the cricoid.
Okay, could you hear? Was it clear? No, I don't see it now. All right. So we'll wait for 7 o'clock. Okay. All right. Yeah. Maybe I should mute my microphone. Check, check, check. Check, check, check. Check, check, check. Check, check, check. In 3 minutes, we'll go online. Vanakkam and welcome to INIA TV's Healthy Voice, Your Choice. This lecture is sponsored by INIA TV and VASI PLLC, and we are going to talk about human voice production today. This lecture will have the following contents. We'll talk about the structure and function of how voice is produced. We'll talk about the primary parameters of voice, and then look into the role of voice in our daily living, factors that can affect our voice problems and disorders. I'm not going to cover everything that's under this topic. We'll just pick the major ones that we would come across. And how to prevent a voice disorder. We'll talk about that. We'll talk about some tips. This will include vocal hygiene, which is the most important one, and discuss treatment of voice disorders. If you have any questions, you can go ahead and type it in the chat section, or I would prefer if you could hold on to your questions and wait for the question and answer round. We will go through that. Structure and function, technically this is called anatomy and physiology of voice, but let's keep the simple terms. Now, human voice is produced at a specific level, or I would say the sound is produced at a specific level right around your neck area. I'm going to ask you to put your palm around your neck, the anterior or the front part of your neck, and just give me what you would sense is some vibrations in your palm, and that's the basic sound that we produce. On the right side of the screen, you're seeing the anatomical structure of this particular organ. We call it sound box. You might have heard the term voice box. That's popularly used for the scientific term called larynx. But I try to stay away from the term voice box because what you feel or what you just felt when you put your palm around your neck and go up is what this sound box is doing. It's just producing vibrations. The rest of it is coming from the vocal tract or your throat, mouth, and nose or nasal cavity. The bouncing around of this basic sound, which creates resonance, comes out of your lips as voice. So technically, if you look at it, what the sound box is doing or what the technically voice box is doing is just sound production, and the rest of it comes from resonance. Now, how does this make a difference? Why should voice box be changed to sound box? When you talk to someone who has a voice problem, notice that they'll point to their neck, or they'll say that my voice box is not working well, my voice box is hurting. So they think about the voice right at the neck level and they ignore the resonance aspect or the amplification aspect that could easily be tweaked, thereby letting the sound box doing a minimal job or giving a good vocal economy. So I would recommend using the term sound box in future when you talk to someone about voice. Let's take a look at this video where it's going to give you a run over on how voice is produced.
The larynx is a critically important structure for both life and for speech. It is buried deep in the tissues of the neck. The larynx is made up of a series of cartilages placed atop the trachea. The cricoid cartilage sits immediately on the trachea, and the thyroid cartilage articulates with the cricoid. The tiny arytenoid cartilages sit on the posterior cricoid cartilage. The vocal ligament of the vocal folds runs from the arytenoid to the thyroid cartilage. The lateral cricoarytenoid muscle closes or adducts the vocal folds, rocking them toward the midline. Phonation for speech is initiated by simultaneously starting airflow from the lungs and trachea and bringing the vocal folds closer together. When the folds move closer together, the air pressure between them drops, and the vocal folds are sucked into the airstream and are pulled closed. The air pressure beneath the folds blows them open, but they are pulled back together by elasticity and the negative pressure of the Bernoulli effect. This cycle is repeated over and over until the vocal folds are abducted or removed from midline. When you look at the vibrating vocal folds in cross-section from behind, notice that they open from the bottom to the top, and that they close from the bottom to the top. This is a critical contributor to the complex acoustical phenomenon of voice.
Okay, so we just saw a technical demo of how voice is produced. Let me just make it simple, and I'll take you back to this picture. Now, the structure that is right at the center is called the thyroid cartilage. If you put your palm around that particular area, you will feel a hard structure. It's also called Adam's apple, but Eve's have it too. All of us have it. And if you put your palm right there and swallow, you will feel a structure raising up and coming down. So you will feel a thyroid cartilage, and this is the largest structure in the neck. If you feel around it, if you put your fingers around it and gently push it, you should just feel slight pressure but not pain. If you sense pain, that is a good sign of muscle tension, which will lead to voice problems or voice disorders as well. Okay, so putting all these technical aspects aside, we do have a sound box that has tissues inside or muscle inside that vibrates and that produces sound. And let's go deep in and take a look at the vocal folds through an endoscope or a camera that is looking into the larynx or into the sound box.
In this soprano,
You can see how vibration amplitude and glottal closure vary with the laryngeal frequency. Here is a short example of the chest register mechanism, a short example of the head register mechanism, then 2 octave jumps, resulting in a sharp variation in laryngeal mechanism and particularly in vocal fold tension. In slow motion replay of the second octave jump, the changing mechanism is all the clearer. Low frequency, high frequency with vocal fold tension. Return to low frequency with relaxation of the vocal folds. High frequency again. Low frequency.
Okay. So now what you're seeing in the screen is a screenshot of that vocal folds. The pearl white structure that you see are the 2 vocal folds. And on top of that or above that, you see again 2 band-like structures. We call them false vocal folds. And all these structures generally clamp together or close that entire port when you're swallowing or when you're choking or when you're coughing. All these come together so that you can expel any of that phlegm liquid trying to enter your lungs. Or whenever you're coughing, you have all this mucus that's floating around. But during voicing, it is just those pearl white structures, one on the left and the other on the right. They vibrate and produce sound. The sound that comes out of your throat, mouth, and nasal cavity gives that classic resonance and adds to your voice. Each one of us have a different voice primarily because all these structures are different in length, size, shape, texture, and all the other tissue-related features. So 2 of us may produce the same vocal fold vibration, or the rate of vibration could be the same. We can make the vocal folds, let's say, vibrate at 100 cycles per second. So when 2 of us do that, we will sound different, or we will sound like us and not like the other person, because we have a different vocal tract, a different muscle texture around it and tissues around it. The length of our throat and oral cavity and nasal cavity are different. So resonance plays a huge role in our voice. Let's take a look at common voice parameters that we generally talk about when we talk about voice. The first one is frequency or pitch. Frequency is the rate of vocal fold vibration, and pitch is just a psychological perception of this rate. In general, when the vocal folds vibrate faster, we hear a high pitch, ah, and if the vocal folds vibrate at a lower rate, we tend to perceive a low pitched voice. Oh. So all that musical notes that we talk about are basically what is the rate of vocal fold vibration? How fast is it or how slow it is? Based on this, our pitch perception will change. Intensity is how strongly the vocal folds vibrate or how much they go to the lateral sides or to the left and right and then come back to midline and clap each other. So just like clapping hands, if you take your hands further and then come to midline, you give a stronger clap. And if you're very close to each other and you try to clap, you're soft. So that amplitude of vibration is what we perceive as loudness. And if the vocal folds come back together with a stronger pressure, then we perceive a stronger, loud voice. Timbre is another technical term for quality of voice. Voice quality is, again, a perceptual feature, and each one of us can give a different terminology for the same feature. Let's say you hear a rough voice, some could call it hoarse, some would call it abrasive, and some could call it pressed. So what we perceive and what name we add to that quality of voice can change based on our experience, based on our vocabulary, I would say. Role of voice in daily living. Now, as humans, we use our voice for communication, for talking, for speaking professionally, or non-professional reasons. And let's take a look at some of the common reasons why we produce voice. Speech communication is the most important because as humans, we differ from our primates by the ability to speak. Our speech can be based on the content of what you're talking. We can reflect emotion through voice. You can, when you talk, one can definitely tell you sound depressed. Hey, you seem happy. What's the good news? So you can reflect your emotion just by the way your voice would sound like. We use our voice for emergency, like screaming, yelling for help. All those are pretty important reasons to use our voice. We also use our voice at a professional level. Now, most of us in this world are professional voice users. Our daily living or our income is based on our voice. So, professional occupational speech is very critical for us because when we lose our voice, we have a chance to lose income as well. Professional voice users can also, the most common ones are school teachers, attorneys, sales reps, telephone operators, aerobic instructors. You have seen people who would be on the bike and talking about how fast you should go, how slow, and all your high intensity, but their speech will be almost as natural as they can. Some of them try to yell, shout, and scream to encourage you, but here again, they're using their voice. Coaches, think about a football coach standing in the field and trying to coach his players. That is an extreme level of using voice. Cheerleaders, again, they use their voice to cheer their team. Call center employees, these are some of the latest, recently included people because with technology, we have come up with all these global call center employees who have voice problems. We also use our voice for a recreational purpose, which can also be professional. Say someone who's singing for recreation could also be a professional singer. So singing, acting, stand-up comic, voiceover artists, all those who use their voice at a recreational level could also be using it at a professional level as well. So these are some of the most commonly reasons why we use our voice. Now, factors that can affect our voice, let's take a look at that. That's the primary role of this lecture here. Now, our voice can be affected by several factors. One could be external, which is at the environmental level. We have no control over it. Well, even though we are responsible for all the air pollution that's going on and noise around us, for now, let's just put it as external. So anything in the environment can bother your voice because you're breathing in air, and if there is pollution in air that you're breathing in, it's going through your larynx. So the windpipe, which is where the larynx acts as a check valve, checks what you're breathing in. It looks for anything that's not air, but at the same time, the air that's going past through it leaves its deposits on our vocal folds. So if the air that you're breathing is gunky and dirty and polluted, your vocal folds will act as a filter and trap all these over it. And then it can start to annoy your vocal folds and lead to phlegm and mucus around it, which will make you cough and clear your throat often. Noise around us. And you must have noticed this when you're talking to your friend in the library, you're going to be really soft. Not just with the reason to not to bother others around you, but you don't have to yell because it's a quiet room. But if you're talking, in a cinema hall or while walking on a road, you are going to be loud because the sound around you is loud. So you will try to compete with that loudness, and you will try to be louder than what's around you. Sometimes that's subconscious; it's not intentional. You automatically get to be loud. Medical reasons that can affect, as I mentioned in air pollution, allergies are some of the common reasons why one can have a poor voice. If the allergy is more upper respiratory or if it's around your nose and throat area, that is going to lead to a lot of phlegm, cold, and all these will make you cough, clear your throat, and you can lose your voice there. Stomach acid. Now, if you have acid reflux, it's popularly called as GERD, gastroesophageal reflux disease, where the acids coming out of the stomach has a chance to come all the way up through the food pipe and enter your throat and bother your soft tissues around the vocal folds or the sound box. Now that again will lead to a lot of throat clearing activities, coughing, and bother your voice. One could have an abnormal larynx for several reasons. We'll talk about that later. And some could have a birth defect, which can be abnormal vocal folds, poorly developed vocal folds, or absence of specific tissues in the vocal folds. And that could lead to a voice disorder. And that will need medical attention. Internal factors are functional factors, meaning how we use our voice and how we tend to have a voice problem because of that. Now, behavioral voice problems could be because of misuse of voice, such as using it inappropriately, like mimicking somebody's voice, mimicking an animal, or mimicking a train, bus, and all these. Overusing your voice. You can have the healthiest voice in this world, but if you're overusing it, especially school teachers who will have to talk for 5 days, for 8 hours a day, come back home, and then work with their kids and all those. So if you're overusing your voice, even if you have a healthy voice, you will end up with a voice problem. Abusing your voice is like making your voice being used or trying to ingest um, let's say smoke or any other agent into your lungs through your vocal folds, like smoking, alcohol to some extent, and drugs. All these can affect your vocal folds as well. Inappropriate pitch and loudness. So many of us have not realized what our optimal voice is. So in that case, we tend to look at someone, admire someone's voice, and try to adopt their voice. So in that case, that pitch and loudness that we're using may not be optimal for the one that our voice box or sound box is designed for. And if that behavioral voice or habitual voice, as we call it, if it is too far away from your optimal vibrations, then you will soon land up with muscle tension, vocal fatigue, which means being tired, and then you will develop a voice disorder. Untrained voice, here I mean someone that's not trained to sing or do a specific vocal act and ends up doing it just for fun or has a habit of doing it. So we've seen a lot of untrained singers who tend to sing like an opera singer or use specific pitch ranges which they have not been trained for, and that could lead to voice problems. Mimicry, I mentioned, in misuse of voice, trying to make your voice sound like someone else or something else. Voice problems and disorders. Let's go from the most mild to severe. Common cold or a sore throat. You would have noticed that when you have a cold or a sore throat, your voice changes. You may not even feel the sore throat or common cold. You may not even know, but that slight change in voice will be the first thing to happen because during an infection in the larynx, the vocal folds swell up. They add mass, become heavier, your voice gets a little deeper, and you may start feeling some phlegm sticking to your throat. This one, even though is not a serious condition, if you use your voice heavily during this time, you can lead that to a voice disorder. Let's say a singer has cold or has a sore throat and is being asked to perform. Now, for singers, pitch and loudness and all their intricate intonation and voice is pretty critical, right? So they will try to overcome this common cold and sore throat to get their perfect voice by putting more effort. So they are already there at a level where they are not putting their regular levels of tension. They've added too much tension and they're going to sing for an hour or two, and that could lead to a voice disorder right there. Muscle tension, again, as I mentioned, if you're not using the right pitch and loudness that your sound box has been designed for, you are putting muscle tension. You're not letting your natural vibrations come out. You are adding more tension to create a different vibration, and a continuous use of that or overuse of that will lead to muscle tension voice problems. Pain in the neck. With this muscle tension, you will feel pain in the neck. And yes, voice disorder is a pain in the neck. You will sense muscle tension or a strong pain around your anterior or the front part of your neck where you felt the sound vibrations during the start of this lecture. So that pain is pretty common for people who have voice disorders because of that induced muscle tension, which is primarily saying that, hey, you are working too hard to produce your voice, and now you have a pain in that neck area. Pubertal changes. Boys and girls after a specific age, 11 to 13, tend to go pubertal changes, and larynx or the sound box is a hormone dependent organ. When all your hormones change, vocal folds and the entire larynx also tends to grow. This change is pretty rapid in boys, and that's why you see that neck popping out or the Adam's apple popping out and voice just going all the way deep. And in between, you have this crackling stage where the voice is neither too high pitched or low, and it changes back and forth and it leads to embarrassment. But that's just a natural change that boys go through. This happens with girls too. However, the change in pitch is not too much. For boys, it's almost an octave drop. So, for example, if they are at a 200 hertz vibratory range, after pubertal changes, voice drops down to 100 hertz or 100 cycles per second. That is a drastic change in voice, and that's why the crackling and that's why the embarrassment and all those. For girls, the change is just by a couple of notes, so it is audibly detectable, but not too much of a change. All right, and that's why if that boy or a girl is a singer, they have trouble during this particular time because they are not right at their natural range. So the singing teacher will have to work with them in different ways to keep the training go on, but keep that pubertal change in mind. Now, boys who do not want that change, well, they cannot stop it, but if the voice has changed, but if they do not want to show that out, they will continue keeping that high pitched voice go on. But now, as I mentioned, the larynx or the newly designed sound box is no more suitable for that high frequency sound. So the boys will struggle in keeping that high pitch and then end up with medical problems or voice disorders called puberphonia. We'll come to that a little later. One could have a mass on vocal folds for several reasons. Now let's take a look at the common ones. Vocal nodules are because of continuous excessive use of voice. Even though you have a healthy voice, as I said, if you're overusing it, or if you're having an inappropriate voice and using it for a long time, you could develop nodules, which is basically a callus-like growth on the vocal folds. Polyps are when you scream, yell, get to the highest pitch that you're not trained for. The vocal folds that stretch and shrink during these vibrations can just snap and produce a blister, and that could lead to voice disorders. Granuloma, again, is a growth on the vocal fold. Cyst, again, is a tissue growth there. We'll take a look at these. I have some videos to show you for these conditions. Ranker's edema is basically a polyp which is primarily due to smoking. Acid reflux can induce this as well, but let's take this as a public address. Quit smoking because it can lead to voice disorders, primarily singers, actors who rely on their voice, or school teachers, anyone who's relying on their voice for their profession will have to keep Ranker's edema in mind, and I'll scare you with a video a little later. Acid reflux, as I said, most of us will sense heartburn, which is a common symptom that you would see for acid reflux. However, the acid reflux that leads to voice problems need not start with the heartburn symptom. So most of the time when we see our patients and say, hey, you have acid reflux and that's leading to a voice problem, they say, well, I don't think I have acid reflux because I do not sense heartburn. So this type of acid reflux is when the acids that's coming out of your stomach, going through your food pipe, does not stay in the chest region to give that heartburn symptom. It gets pumped all the way up to your throat, and it gets pumped into your windpipe. So those kinds of acid reflux are usually, they start with the classic heartburn acid reflux, but then get chronic and become acid reflux that affect voice. Scar on vocal folds can be for several reasons. Usually, if a patient goes through surgery right at the vocal fold level or has been intubated for any other kind of surgeries, the intubation goes through the vocal folds. So there is a chance that surgery or intubation can affect the vocal folds and keep a scar, and that dry scar can affect vibrations. It can be acquired for, again, several reasons. One could have a blister. The blister could burst open up, and then that blister could dry up as a scar. Some infants are born with a scar in their vocal folds, and that stays there to affect their voice in future. Laryngeal cancer, cancer of the sound box. Now, given that cancer is a massive growth of tissue which has to be excised or removed from the body, if it is in the laryngeal or sound box area or on the vocal folds, there is no mercy. We will have to take that tissue off, even if the entire sound box has to be removed. It has to be, because we all know the effects of cancer. So the surgeon may not be thinking about voice there, they'll be thinking about saving the patient's life. Human papilloma virus is a virus, as mentioned here, which can be transmitted from one person to the other for several reasons. We'll talk about that if you're interested. And this, again, can grow as a tumor in the larynx. And again, the method that's successful is to surgically excise these polyp-like growths. Paralysis, stroke, or anything neurogenic, if the nerve that is innervating or that is being supplying the larynx, it's just like electric cables running from the switchboard to the bulb. If any of the wire there is affected, the bulb is not going to glow. Similarly, if the wires or the nerves going to the larynx is being affected for several reasons, that could lead to a paralysis and stop the vocal folds from vibrating. Sometimes it could just be one side of the larynx, and sometimes both. Now, depending on whether it's one side or both sides, the effect in voice can change. Some patients may have a condition where the wiring or the nerve is just twitching, just like how a bulb would flicker because of the interruption in current. Voice can also have a twitch where the nerve that's taking electric current to the vocal folds may just have a repeated twitch, and voice may sound that's wobbling or having excessive pressure and release of pressure back and forth. Aging is, again, a common condition that can affect voice, just like any muscle in our body that thins out or loses bulk as we grow. The muscles in the vocal folds will also thin out and lose muscle strength. So the vocal folds that come together to vibrate now will have a gap because the muscles are thinned out, and voice will sound husky, breathy, and weak. And that's how our grandparents sound breathy or sound weak as they talk. Let's take a quick look at what laryngitis, or the common sore throat, common cold condition, looks like. So you are looking at the vocal folds, the shiny white structure that you see there. This may not be the best. Let me let it vibrate, and you'll see the vocal folds being inflamed. And what I mean by that is it doesn't look pale white anymore. It looks more red.
With serious difficulties in the singing voice. The vocal folds are inflamed with vascular dilation and mucosal secretion. Laryngeal vibration is relatively unaffected at low frequency, but grows unstable at higher pitch when the folds are thinner and tenser. This brings about irregular vibrations, hence a rather hoarse voice quality.